Our government is committed to improving the health of our citizens.
We want our people to also help us, as it's been done all over the world, to stop medical tourism, to make sure that we have the standard of care expected in our operating rooms, and to make sure that when our patients come to the operating room, they get the best they can ever get without having to travel abroad. That is why this endowment fund is being launched.
A leader that has a vision and a team that is committed. And the third thing is now to put the resources to help the health system. And so the Health Endowment Fund in Oyo State is the first in Nigeria and maybe in Africa to touch the infrastructure of healthcare.
Our goal is to really reform healthcare system, to be able to provide high quality universal coverage in a cost-effective manner.
Before the current administration in Oyo State came into office in 2011, the healthcare system was in a state of disrepair. Most of the public hospitals were in a deplorable state with a demoralized workforce. This culminated in poor health indices and loss of confidence in the healthcare system by the people. That was the state of affairs when the good people of Oyo State voted in His Excellency Senator Abiola Ajimobi as the executive governor of the Paysetter state. As a dynamic and visionary leader who understands that the responsibility of government is to promote the well-being of its people, the governor critically assessed the situation and began taking steps to reposition the health system. In 2012, the governor launched a free health mission, a program which provides free medical care to the less privileged in the state. Many patients had surgeries for hernia, lipoma, and other life-threatening conditions. The free health mission provided screening and treatment for malaria, high blood pressure, diabetes, family planning, and HIV/AIDS services, among others. Over 1 million patients have benefited from the free health mission.
The free health mission, which we started in 2012, we've treated over 1 million people on this program. It's free.
The state government also procured fully equipped ambulances manned by trained health personnel to provide first aid treatments in emergency situations to accident victims and other members of the public with medical emergencies. To boost the morale of the demoralized health workers and to demonstrate his commitment to their welfare, Governor Ajimobi approved the increased pay package for health workers known as Consolidated Health Salary Structure, CONHES. After his historic second-term election victory, His Excellency Governor Ajimobi appointed a Harvard-trained vascular surgeon, Dr. Aziz Bukola Adedutan, as Commissioner of Health. His assignment was to midwife the delivery of the governor's vision for the health sector. The health commissioner wasted no time as he immediately embarked on a tour of government-owned health facilities. The health commissioner, accompanied by top officials of the ministry, visited state and general hospitals and other public health facilities in the 33 local government areas of the state. At every government hospital visited, the commissioner usually directs the most senior official to draw up and send to his office a list of medical equipment, infrastructure, and needed manpower that would enable the hospitals function optimally. To ensure that residents of Oyo State enjoy quality health care, the Commissioner of Health also led the ministry's task force on routine monitoring and inspection of private healthcare centers. These visits were to rid the state of unwholesome medical practice. Not less than 30 substandard private hospitals and diagnostic centers have been closed down by the state government to safeguard the health of the people. With the needs assessment of the government and private hospitals conducted, the foundation was thereby laid for the next phase in Governor Ajimobi's vision to transform and reposition the health sector and make Oyo State the Mecca of medicine in Nigeria. In the last 6 years, Oyo State government has done a lot to improve the healthcare system. The government continues to collaborate with development partners, including United States Agency for International Development, USAID, World Health Organization, Global Fund, the Federal Ministry of Health, and non-governmental organizations to provide strategic interventions. Through constructive engagement by the state government, USAID has provided support towards malaria control. Incidence of malaria has been reduced by 43%, made possible through mass distribution of insecticide-treated mosquito nets to millions of households, amongst other interventions.
Malaria has been killing children and sapping the strength of the whole population for tens of thousands of years. It is impossible to calculate the harm malaria has done to the world.
The wife of the governor, Her Excellency, Chief Mrs. Florence Ajimobi, who is also the Oyo State Net Ambassador, is lending her support to the campaign against malaria. Using her goodwill and influence, Mrs. Ajimobi continues to raise awareness about malaria prevention, encouraging women to embrace the use of insecticide-treated mosquito nets to protect their families from mosquito bites. Oyo State is today the leading state in Nigeria in the control of the spread of malaria, as confirmed by the Director, USAID, Dr. Michael Harvey.
We encourage health workers to routinely provide a net to a pregnant woman at her first prenatal visit and during the child's immunization, helping to protect her and her baby.
In addition, through our NGO, Access to Basic Medical Care Foundation, the First Lady is providing free health services. Through its 12 functional clinics, Access to Basic Medical Care provides family planning services, antenatal care, immunization of children under 5 years, cancer screening, and other medical care to residents of the state, free of charge. It is on record that 500 patients receive treatment at these clinics daily. Chief Mrs. Ajimobi, who has won several awards for her humanitarian effort, is a strong advocate and mobilizer in the battle against all forms of cancer, particularly breast cancer and cervical cancer, which affect many women today. As nations of the world are no longer being rated by their per capita income, but by their maternal and infant mortality rates, Oyo State government continues to give priority attention to maternal and child health. Primary health care is receiving tremendous attention with an enabling law establishing the State Primary Health Care Development Board to put primary health care under one roof for greater efficiency. Routine immunization of pregnant women and children from 0 to 5 years is conducted throughout the state on designated immunization days. Massive sensitization and public enlightenment campaigns are being executed regularly to create awareness and increase access to immunization. In the last 7 years, Oyo State has not recorded a single case of polio. In the area of family planning, Oyo State has also been adjudged the leading state in the use of contraceptive methods in Nigeria today. The state is also the designated Southwest Treatment Center for Vesico-Vaginal Fistula, VVF, and the center will move to its permanent site before the end of the year. To upgrade medical equipment in public health facilities, Governor Ajimobi in May this year commissioned $2 million worth of medical equipment and supplies donated to the state by the Nigerian Women Association of Georgia in United States of America in collaboration with MedShare Incorporated. Oyo State is the first in Nigeria to launch a universal health insurance under the established Oyo State Health Insurance Agency. With 650 naira monthly premium, residents of the state have access to affordable health care. Under the scheme, pregnant women and children under 5 years can access medical care free of charge. This move is to ensure that Oyo State achieves the Sustainable Development Goal target to end preventable deaths of newborn and children under 5 years and reduce maternal mortality. But despite these laudable achievements, much is still required to be done to take the healthcare delivery to the next level. With the dwindling economy and increased demand in health expenditure, the need for individuals and corporate bodies to join hands with government in financing health becomes very imperative. For health is wealth. For this reason, Oyo State government came up with the 50 billion naira Healthcare Endowment Fund, an innovative approach to financing public health and meeting the national objective of health for all. The Healthcare Endowment Fund is a call to action directed at well-meaning Nigerians at home and in the diaspora, local and international partners, corporate organizations, groups, associations, and other stakeholders to contribute to the transformation of the health sector.
And so a well-functioning health service is ultimately a matter of importance to all of us.
It is very important for us to move the healthcare forward to a new level in Oyo State. It is not because we are in trouble healthcare-wise, it is because Oyo State healthcare delivery system is in grade 2. We want to take it to grade 1. That is why we are doing the endowment fund.
Healthcare Communications Limited, publishers of Healthcare Magazine, is the consultant working with Oyo State government on the Healthcare Endowment Fund.
We don't have to have an emergency before we take care of our system. And I'm telling you that endowment is the way forward. It's an alternative way of raising funds for development.
The state government, led by Governor Abiola Ajimobi, has demonstrated the political will to transform its healthcare system and take it to the next level.
Our government is committed to improving the health of our citizens.
All well-meaning individuals, groups, corporate organizations, non-governmental organizations, development partners should therefore rise up to this laudable effort.